There's a little bit of variation in my answer to that question. If you have not had sedation, in other words, if we did your surgery with just local anesthesia, you can eat anytime after surgery. Just my only caution or precaution for you is if one side of your mouth is still feeling numb, you need to be careful when you chew not to bite on your tongue or your cheek, but you could actually go ahead and have something to eat. Typically after these surgical procedures, oral surgery, periodontal surgical procedures, we asked you to kind of restrict your diet the first day to softer foods, things that you don't have to chew so much. Soup, for example, is good. If you've been sedated, in other words, if you're post-surgical period, you're also post-anesthesia, we're going to ask you initially to stick to fluids. In other words, we want you to take in fluids to rehydrate. So start with fluids, clear fluids, for the first couple of hours, first several hours, and then eventually you can start to add some softer foods. But if we keep you on liquids and get you rehydrated, you're less likely to have nausea. So we tell you to ease into having, putting a lot of solid food in your stomach. Solid foods and or milk products right after surgery can increase the possibility or likelihood that you'll have nausea after your surgery.